Hi all. So, as some of you might know, I have been off work for a couple of weeks because I haven't been feeling well. I've actually been ill for about 7 years, off and on, relapsing and then remission. So, hopefully, we're getting to the bottom of what the problem is. We think it's called ME, or chronic fatigue syndrome, and I'm having lots of medical checks. So, as you can hear, I'm a little bit out of breath. So, I'm feeling a bit better today, a little bit more energetic, so I have the time to make this video. And I thought it would be a great video to make for those of you who might be studying medicine or who are interested in health and medicine. Okay, so yes, I have various issues like extreme fatigue, and it can come and go. So maybe I'll spend 3 months working as normal and then I'll crash and I'll be exhausted for a couple of weeks. And normally it takes about 3 months for me to get my energy levels back up. Anyway, there is some research that suggests that people with this condition do have some heart problems as well. So the other day I went for an ECG, which is a short test that measures what your heart's doing, and that test came back as abnormal, which it flagged the results as having a left ventricular hypertrophy, and that is quite a common condition, and it can happen to different types of people. It can happen to very fit, athletic people, and as some of you may know, I used to be very fit and athletic, so it could be something kind of normal as a result of my athleticism, but because of my illness, I haven't really been very fit for a long time. There's also hypertension-induced left ventricular hypertrophy, and that's to do with having a high blood pressure, which can be to do with a poor diet, drinking alcohol, all those kind of things, or it could be genetic. Now, I don't have high blood pressure. If anything, I have low blood pressure. So I haven't spoken to the doctor yet, but we had the results back, and today I'm having a Holter, or I have got a Holter monitor fitted to me, which I have to wear for 24 hours, which will hopefully give my medical team a better understanding of what's going on with my heart. Is it serious? Is it normal for my age? Is it normal for someone who was an athlete? And it will give some more insight into my illness, which is very, very misunderstood disease, and science really doesn't know much about it. But there is evidence that people with my illness do have some issues with their heart. Anyway, as you can see these are electrodes, and I have these all over my chest, and I stand up. So they're attached, there's all these electrodes, there's 1, 2, 3, 4, 5, 6, 7 electrodes attached to 7 areas around my chest, and all the information is recorded in this little monitor. I'm a bit scared to open it. You can see the light is flashing to show that it's recording. I don't want to turn it off by accident. So yeah, I'm too scared to take it out. But yeah, so I have to carry this around with me, and I have to act like normal, do my normal daily activities, and see what it measures. So over the last couple of weeks, I've actually been taking it a lot easier. I have a wrist heart rate monitor. Now you can buy 2 types of wrist monitors. There's this one that just works through, I'll show you. It has these little lights, and those lights measure the blood flow through your arm, and it gives you an idea of what your heart is doing. And for people with my condition, there's people much, much sicker than me. I'm only affected mildly, thank goodness. But what it does is it sets off an alarm that tells you that you're working too hard, your heart's working too hard, and it tells you to stop doing that work, sit down or lie down if you need to. So I can go about my daily activities quite normally, but if it buzzes, it means I'm working too hard. Okay, so these heart rate monitors aren't particularly accurate, but you can get ones with a chest strap that goes around your chest. Sorry, my screensaver just went on. Okay, you can get ones with a chest strap as well. So basically what I'm doing is I'm checking what my heart is saying, and if it beeps and tells me that I'm overworking, I can write it down on a piece of paper. I also have to write down every single activity that I do and say whether I felt heart palpitations, dizziness, nausea, shortness of breath, chest discomfort, arm pain, or other pain. I have to write this down. Now, I haven't really got any obvious symptoms of heart problems other than slight out of breath. And I do have some chest pain, but I never associated it with a heart issue. I just thought it was muscle ache, so I really don't know what's going on there. So palpitations, that's when your heart beats really, really fast. So your heart's natural sort of rhythm is budum, budum, you know, and it raises if you're running, whatever, but it's the same kind of rhythm. Whereas a palpitation almost feels like you've got butterflies in your heart. It sort of goes, so that's a heart palpitation. And I have had this a few times, but I never, it's so random, it's hard for me to say if it's an issue or not. Then there's dizziness, and dizziness is when your head spins. You know, maybe you stand up and you're kind of whoa like this. That's dizziness. Nausea, so that's when you feel like you're going to throw up, you're going to be sick. Short of breath, which means, you know, activities make you breathe deeply or feel short of breath, and I feel a little bit, very mildly short of breath. And I know this isn't normal because I used to be super fit and an athlete, and I didn't have shortness of breath. And then there's chest discomfort, and there's arm pain. Now, I think if I was having chest pain and arm pain, I would be worried that I was going to have a heart attack. I'm hoping that if I have a heart condition, which I hope I don't, but if I do, it's not so severe as to worry about heart attack or anything like that. Anyway, I've been talking very fast, but I hope it kind of gave you an idea about my health. I'm always going to try and, you know, be online and do as much as I can, but I also thought it was just a great way to talk about certain health conditions. So if you're studying medical English or anything like that, then I hope this video helped you. So if you liked what you see, please subscribe, hit that button down there to subscribe, and you can see notifications of my next videos up there with that little bell. It will notify you when I next upload. I'm apologizing for speaking so fast. I think if you want, please message me and I'll try and get this transcribed if it's really useful for you. But I won't do it unless people ask for a transcription. Okay, thanks for listening and see you soon. Bye bye.